What is more helpful after a traumatic experience? Talking to a therapist and discussing every single detail of your experience, or playing Tetris? The answer is absolutely mind-blowing. In psychology, we know for a very long time that many psychological disorders like anxiety, depression, obsessive-compulsive disorder, and of course post-traumatic disorder often have their roots in traumatic experiences, like for example having an accident, losing a beloved person, or just a very big failure. So a failure, a big mistake, a big error which haunts you in your everyday life, and you always have the question, could I have done better, or why didn't I do this or that? And knowing that these traumatic experiences are the genesis for many psychological disorders, wouldn't it be fantastic if we had some kind of psychological vaccine, like for example a vaccine against rabies, which we could apply right after a traumatic experience in order to prevent the development of a psychological disorder, like for example anxiety, depression, or as I said, a post-traumatic stress disorder. Fortunately, it seems like that we're not far away from such a psychological vaccine. For example, take a look at a study published in 2018 in which 71 people who had a severe motorcycle accident, which usually could lead to a post-traumatic stress disorder, were allowed to play, and I know it sounds really crazy, but were allowed to play Tetris right after the accident. More exactly, they were first told, well, please try to remember your accident and tell us the most stressing details of this accident. And by that, their traumatic memory was activated. And when memories get activated, they actually enter a changeable state. And this is really absolutely mind-blowing and fascinating, because in this moment in which they are changeable, you can intervene by, for example, providing some visual working memory input, like for example playing Tetris. And this visual input is supposed to interfere with the old traumatic memory. I know it sounds absolutely crazy, but the scientists could show that right after this intervention, after playing 20 minutes Tetris, the motorcyclists experienced 63% less of so-called intrusive memories. So those haunting memories that invade our consciousness were strongly reduced in comparison to a control condition. And I wouldn't tell you about these too good to be true results if there weren't already some replications. So for example, in a very recent study published in 2021, they also could show that right after a week, in comparison to a control condition in which the participants were listening to podcasts, again the intrusive memories were reduced for about 48%. And after 1 month, they were even reduced 90% in comparison to the control condition. So this approach of memory interference and memory reconsolidation is in strong contrast to former first-line treatments after traumatic experiences, like for example the so-called psychological debriefing, in which, among other things, patients were asked to describe in detail the traumatic experience to a therapist. But surprisingly, many studies could show that this therapeutic approach, in which you have to speak about the traumatic event in order to structure your memory in a better way, that this approach right after a traumatic experience was astonishingly ineffective. And the reason probably is that by talking about a traumatic experience, the traumatic memories, the memory traces of this traumatic experience become deeper and deeper in your brain, and therefore the traumatic and problematic memories are actually becoming stronger and stronger and more vivid, and therefore also more intrusive. But the new studies about memory reconsolidation and memory interference And playing Tetris, for example, after a trauma, or another approach, for example, might be the so-called EMDR therapy, the eye movement desensitization and reprocessing therapy, in which you move your eyes very fast from one side to the other, and therefore also give yourself a lot of visual input, a lot of working memory input that can interfere with your traumatic experiences. And especially when it comes to post-traumatic stress disorder, EMDR could be shown to be at least as effective as CBT, and in some meta-analysis it was even more effective. These new memory reconsolidation and interference research results show us that right after a traumatic experience, and I guess it could be everything from sexual abuse to bullying situations, for example, right after such traumatic events, it seems to be more helpful to disturb the consolidation of those memories in order to make them less haunting and less intrusive. And from that perspective, let me give you one last real-life example. Think back to the 2020 European Football Championships, in which Christian Eriksen had a severe heart attack during a game, and the whole world was witnessing when he had to be reanimated. The pictures were really horrible, and it was, especially for the players, a very traumatic experience. Right after the game, there were very strong discussions about whether it was the right decision to keep on playing, because after a break, the players were asked and they decided to keep on playing. From the perspective of today's study results, I think this actually has been a perfect decision, because the new visual input they got by playing probably interfered with their traumatic memories. Because playing football, especially in such a demanding game and important game, was very taxing for their visual working memory. And maybe the decision to keep on playing was even very good for us as an audience, because for us the pictures of course were also very distressing. And probably it was better for us to watch a second halftime instead of making a big break in the program and to show the pictures of the heart attack of Christian Eriksen again and again. So whenever you experience a very traumatic event, keep in mind that it might be better to do something that demands a lot of visual working memory instead of reliving the traumatic memory again and again. I hope you enjoyed this episode. Of course, there will have to be more evidence on these new results, and there will have to be a lot of clinical studies. But as I said, we already have a lot of evidence, for example, when it comes to EMDR. So actually the idea of memory reconsolidation is already quite robust. I hope you enjoyed this episode. Of course, feel free to take a look at the books or at the website, and maybe we will see you next time.